Good afternoon. My name is Dr. Renelle Miles, and I want to welcome you to the NIH Office of Disease Prevention Medicine Mind the Gaps webinar series. This webinar series explores research design, measurement, intervention, data analysis, and other methods of interest to prevention science. Our goal is to engage the prevention research community in thought-provoking discussions to promote the use of the best available methods in prevention research and to support the development of better methods. Before I begin, I have some housekeeping items. To submit questions during the webinar, there are two options. First, you may submit questions via WebEx by clicking on the question mark in the WebEx toolbar and direct questions to all panelists. Second, you may participate by Twitter and submit questions using the hashtag NIHMTG. At the conclusion of today's talk, we will open the floor to questions that have been submitted via WebEx and Twitter. Lastly, we would appreciate your feedback about today's webinar. Upon closing the WebEx meeting, you will be directed to a website to complete a seminar evaluation and also send an email with a link to the evaluation. Your insights will help us to continue to improve this webinar series. At this time, I'd like to turn things over to Dr. David M. Murray, Associate Director for Prevention and Director of the Office of Disease Prevention.
Thank you, Renelle. It's my pleasure to introduce today's speaker, Dr. Leonard Jason, who is currently a professor of psychology and the director of the Center for Community Research at DePaul University. Dr. Jason is a former president of the Division of Community Psychology of the American Psychological Association. He has served as the vice president of the International Association for Chronic Fatigue Syndrome, Myalgic Encephalomyelitis, and as the chairperson of the research subcommittee of the U.S. Chronic Fatigue Syndrome Advisory Committee. Dr. Jason has edited or written 27 books, has published over 750 articles and 90 book chapters. He has served on the editorial boards of 10 psychological journals, in addition to serving on review committees of the National Institutes of Health. In 2013, Dr. Jason was presented with the DePaul University College of Science and Health's Excellence in Research Award. In 2015, he was presented the American Psychological Association's Award for distinguished professional contributions to applied research. It's my pleasure to welcome Dr. Leonard Jason and turn the session over to him.
Thank you very much for this invitation to present mixed methods in disease prevention and health promotion research. This lecture today draws on material that was in a book that Dave Glenwick and I edited in 2016 called The Handbook of Methodological Approaches to Community-Based Research, Qualitative, Quantitative, and Mixed Methods. Oxford University Press was the publisher. In this handbook, Dave and I wanted to contribute something about the community-oriented approach, which utilizes a wide variety of contemporary qualitative, quantitative, and mixed methods approaches that were theoretically sound, empirically valid, and creative. We wanted to address in a fresh and innovative manner questions of import for communities in which they work. First, let's talk about definitions. Mixed method approaches combine qualitative and quantitative methods within the same study or project. Quantitative research often is based on positivism, or the belief in a single reality accessible through scientific procedures. In contrast, qualitative studies are grounded in a constructivistic paradigm, and rather than a single, universally shared reality, each participant has his or her own reality. Let's first talk about qualitative approaches. In these, there's an emphasis on the meaning of the phenomena under consideration to those who are experiencing it. Data, which typically consists of words, provides thick description of the participants' experiences. There's an active collaboration between the researchers and the participants throughout the research intervention process. And some examples of these types of qualitative methods are participant observation, qualitative interviews, focus groups, and case studies. Now, quantitative approaches have an emphasis on trying to establish cause and effect relationships. Data typically consists of numbers, and they're obtained by use of standardized measures. In this approach, they try to produce generalizable findings as opposed to qualitative approaches, which focus on specific contexts. As examples of quantitative methods, we have quantitative description, randomized field experiments, non-equivalent comparison group designs, and interrupted time series designs. In one of the chapters of a review of mixed methods in the handbook that Dave and I edited, Valerie Anderson mentioned some of the limitations of research methods. And what she said was that mixed method studies, which use both quantitative and qualitative methods, can offset each other's strengths and weaknesses. In a sense, mixed methods can provide a more nuanced understanding of research questions than a single method can accomplish. Now, there are different types of mixed methods approaches. Often, one is hierarchical. So one method is usually dominant or more central. The other is more secondary or supportive. But that doesn't always occur. Sometimes you have both approaches are, in a sense, equivalent. Also, mixed methods may also be sequential, by first using an exploratory method for discovery and later using a confirmatory method for justification. But they can also be simultaneous. They can be occurring at the same time as opposed to one occurring and then the second one occurring. Now, there are actually many different types of mixed method designs and many different ways of thinking about them. Morse developed one of the first typologies, and I'm going to talk a little bit about that one. The dominant method is usually represented by a capital letters like quantitative and qualitative. And the complementary method, or the what's called secondary method, is represented using all lowercase letters, like quant and qual. Usually there's an arrow used to denote a sequential design, and a plus sign is used to connote a concurrent design. Here you see 9 different combinations: equivalent simultaneous designs, which is qualitative plus quantitative, equivalent sequential designs, quantitative and then followed by qualitative, or qualitative followed by quantitative. And you can also see dominant simultaneous designs, where the primary method is quantitative, secondary qualitative, where the primary qualitative, secondary quantitative. And you also have dominant sequential designs, and you can see some examples of that on the bottom. These are just a few of the examples, and there can be circuitous routes as well. So one can actually have more than 2 different approaches in a particular study or area. Wiggins has outlined different ways of this types of mixing, and it could be triangulating, which allows for converging findings to use multiple methods to increase the study's validity. It can be demarcation, referring to how methods are related, quantitative as a dominant and qualitative as a secondary, for example, and reclassification, referring to how both qualitative and quantitative methods can be used in exploratory and confirmatory ways. Campbell, in a book chapter published in 2012, talked about pluralistic studies, which are also known as mixed methods. Mixed methods research can occur within the confines of a single study or can exist at multiple levels. Let's explore what that means. In one study, a mixed methods approach can incorporate both quantitative and qualitative data collection and analysis. In contrast, a pluralistic research program can reflect pluralism across a program of studies conducted by the same team on one topic. Finally, pluralistic research disciplines are fields of science or scholarship in which a balance of study designs and analysis techniques is used in publications, for example, community psychology. Pluralism also can occur across programs of studies conducted by a team, and I'm going to give today 2 examples of 2 different types of research and how these types of mixed methods were used. First, I'm going to talk about the Paul University team that has been studying recovery homes called Oxford Houses for over 25 years. Real briefly, Oxford Houses have no professional staff and are completely self-run. They're the largest self-help recovery residential program in the U.S. There's over 2,000 homes. And a person can live in these homes as long as they want, but they need to stay abstinent, pay their share of rent, and follow house rules. So we developed a collaboration with this organization with a phone call to the founder, Paul Malloy. And for over a year, we had conversations building trust between the community organization, Oxford House, and the DePaul Research Group. An Oxford House representative was eventually sent to Illinois to set up a group of recovery homes in the early 1990s. And for the first year, we collected no formal data, but spent time attending Oxford House business meetings and building up a relationship of mutual trust. So in our early steps, our Oxford House partners attended our research meetings and tape recorded them so that their members could learn what we were thinking about doing, and so that everyone could have input into this process if they wished. We did not just start collecting data, we focused on building a trusting relationship with our community partners. We determined together what questions should be addressed, what kind of data to be collected, and who should collect the data. So our first study was really a mixed study. It used the equivalent simultaneous design, which used both qualitative and quantitative methods. The qualitative methods were really trying to understand, why did people want to live in these Oxford houses? Why did they join them? And we really found it was a place that was safe, and it was a place that people could have fellowship with others. But we also had some quantitative questions. We wanted to find out the sociodemographics of these houses, which turned out to be very comparable to other treatment type settings. And also we found that the longer people lived in these houses, it seemed like the better outcomes in terms of abstinence. So those were some more quantitative methods that we approached in our first study of this particular organization. During the 1990s, our research group submitted a number of grant proposals to collect longitudinal data from the Oxford House members. But NIH reviewers asked us to conduct a randomized study to determine whether or not these homes could lead to reductions in substance abuse. We informed the grant reviewers that a randomized design was not feasible, as each Oxford House voted on whether to allow new members to live in their house. So we finally approached the founder of Oxford House, Paul Malloy, with this predicament, and he said he would work with us toward a randomized study. So the willingness of Oxford House leadership was likely a direct result of years of mutual trust building using both quantitative and qualitative methods. This mixed method approach really brought us closer to this particular organization and allowed them to want to help us with the research. So we did finally get funding from NIH in a quantitative study. It was a 2-year longitudinal study funded by the National Institute of Alcoholism and Alcohol Abuse. It included 150 participants recruited from a variety of inpatient treatment centers throughout Chicago, and participants were randomly assigned to either an Oxford House or usual aftercare after finishing treatment. Those in the Oxford House condition over a 2-year period had significantly less substance use, higher employment, and lower criminal justice-related outcomes. And these are examples of 2 years later, the Oxford House had about 69% abstinent versus 35% for the usual care control. Incarceration rates were significantly lower in the Oxford House, and monthly income were significantly higher in the Oxford House 2 years later. So over the next number of years, we instituted a multitude of quantitative, qualitative, and mixed methods designs, and we've actually published in the Journal of Community Psychology, first author is May, a summary of this research. And here's again some examples of some of the work that we did. And there is a paucity of research on the role of natural mentoring relationships in substance abuse recovery. So our first quantitative study really gave us a glimpse that something else was going on. We found that if you had a best friend in the Oxford House, that was the best predictor of long-term outcomes. If you could just find one person who you could find to be a friend, you stayed in the Oxford House longer and you had better outcomes a couple years later. This led to a series of equivalent, simultaneous, and ultimately sequential studies, which I'd like to report on briefly. Lawler, for example, used focus groups paired with a series of empirically validated quantitative measures to better understand natural mentoring relationships. In the qualitative section of the study, we had focus group questions were created with the input of Oxford House residents, and the nature of these mentoring relationships was described during focus groups. As an example of the richness of this process, one male participant explained, "I usually go to any of the guys. That's why I put 5 of them on there on the survey regarding the number of mentors in the house. I didn't just put one because we all have different personalities. So there's a certain thing that you can speak to, certain individuals that will help you out and lead you the right way." The quantitative findings resulted showing that the mentoring characteristics and activities actually predicted social support and helping behaviors. So the use of both quantitative and qualitative methods in this study provided a rich empirical support for the characteristics of natural mentoring relationships and their importance for Oxford House residents. Ultimately, John Light, a sociologist at Oregon Research Institute, and Nate Dugan, a person at Ohio State, began working with us as well on trying to understand some of the dynamics using the more quantitative methods of looking at, for example, trust in Oxford houses over time. And we found that trust relationships tended to be a bit more symmetrical, which this graph shows, but confident relationships, the element of role specialization, where someone's a listener, did not generally confide in the other person. We didn't see that type of reciprocal nature as we did with trust. So, in a sense, the methods and results of one Oxford House study often shed light on the results of another study or inspired the design of a new study. So the dominant sequential from quantitative to qualitative to quantitative actually has occurred in a number of our studies. So while conducting a nationwide longitudinal study of an Oxford House, through qualitative findings and discussions with members of the Oxford House organization, we found that Latinos were underrepresented among Oxford House residents. This awareness stirred curiosity about Latinos' perceptions of Oxford houses and recovery and potential barriers that Latinos encounter when entering an Oxford House. To address these questions, us as researchers helped with the Oxford House organization, and we conducted a series of qualitative studies that revealed that Latinos had a positive recovery experience in Oxford House and that more Latinos could potentially benefit from participating. So the quantitative study was really, the quantitative study was an NIH grant where we actually did the findings of the qualitative studies helped us basically do a quantitative study, which was a quasi-experiment in which Latino residents of traditional recovery homes were compared to Latino residents of culturally modified homes, with funding provided again by NIH. So I would like to now switch to another area, which is chronic fatigue syndrome, CFS, or ME, myalgic encephalomyelitis, which, as some of you might know, is as debilitating as type 2 diabetes, congestive heart failure, MS, or end-stage renal disease. And real briefly, Stigma, over the past 3 decades, there's a series of key decisions that were made concerning methods for gathering prevalence data, the name, and treatment approaches for these illnesses. Most of these decisions were formulated within a societal and political context in which this illness was assumed to be a psychologically generated problem. Physicians have also regarded fatigue as one of the least important presenting symptoms. Mixed methods were especially suitable for research in pursuit of social justice for marginalized populations like those with ME and CFS because it's more sensitive to context. It's more likely to uncover power differentials and to give voice to participants. In such controversial community contexts, the employment of a purposeful, multi-phase mixed methods program coupled with the values of community psychology can be a tool especially suited to provide patients, healthcare workers, scientists, and government officials less stigmatizing ways of understanding this illness. So let me give you an example of some work that we did in this ME and CFS area. The CDC in the late 1980s had conducted studies primarily with ME and CFS, and they found that it was a relatively rare disorder, primarily affecting Caucasian women. We listened to patient groups who challenged these findings, and our group launched a more community-based study rather than physician-based study that randomly selected individuals from the community and then brought them in for workups. Our estimates suggested that 20,000 people were affected, and that's what the CDC had suggested. And rather than 20,000, our findings in 1999 suggested that it was closer to 1 million. So we used sequential nested sampling procedure. So for that particular study, which was done from 1995 to 1997, 10 years later, we basically did an equivalent simultaneous design where we used both quantitative and qualitative methods. We wanted to find out 10 years later, after finding the prevalence rates of 0.42, which suggested that there were 1 million people with this illness, we wanted to then look 10 years later, those who developed this illness over this period of time and those whose diagnosis remitted over this past decade. So our quantitative outcomes involved recontacting the participants and giving them a complete medical and psychological evaluation. Our quantitative data suggested that our prevalence rates had remained somewhat comparable over this decade. This helped answer an important question. Were illness rates increasing, decreasing, or staying the same? Our qualitative methods were used to provide us with a deeper understanding of the interaction of the multiple systems involved in this chronic illness, as well as to hear the voice of the patients. A coding system was developed through a grounded theory framework in order to focus on the context-dependent and structural processes within the data. So qualitative themes, the community response to the illness included these types of things from the medical community as well as related networks, such as support groups. An example, many patients mentioned that they experienced negative attitudes, such as physician minimization of their illness. Furthermore, many respondents told of their obstacles to securing disability in a climate where the illness encounters disbelief. Also, there was the theme of identifying the community response to the illness was an essential component of understanding the systems involved with the experiences of its sufferers. So what are some benefits in this ME and CFS arena of using mixed methods approaches? The qualitative methods allowed us to better understand the experience of the patients who had been identified in the prior epidemiological study. Now we had a 10-year follow-up. It provided us an opportunity to look at the connection of illness to the distribution of power and privilege within the medical community, as well as the social response to chronic illness and health care. Thus, we found, as Ponterodo suggests, that mixed method approaches can provide multiple windows into the lives of the less empowered and historically silenced within our society. So what are some of the distinctive benefits? Well, qualitative methods were used to help us develop better quantitative methods to study epidemiology using community-based samples. The sample generated was subsequently used to probe qualitative features of the illness experiences of patients. Quantitative research provided us data on the magnitude of this illness. Qualitative methods allowed us to better understand the unique challenges and stigma that the patients had experienced from their families, friends, and treatment professionals. These data provided us data that allowed us to provide better appreciations of the magnitude of the effects of this illness on patients. We used these data ultimately to estimate the economic costs of this illness to our nation. So let's talk about mixed method approaches in general. This approach more accurately represents the illness to family, friends, and healthcare professionals, and thereby has the possibility of improving the services to those affected. These types of integrated and value-based approaches are useful for the purpose of advocacy research that works toward the understanding and empowerment of other similar groups who may experience negative social perceptions and dismissive treatment. But there are certain challenges to doing these types of mixed method approaches, and we'd like to kind of mention just some of them. First thing, there's no definitive guidelines for how to conduct a mixed method study. Also, integrating multiple data sets is a complex task, especially when they come from different methodological traditions. There's also a lack of in-depth training by scholars in both methodologies. Often people are trained in qualitative methods, other people are trained in quantitative methods, but very frequently people don't get training in both of these methods. Finally, it's challenging in publishing, due to page and word limits in journals. Often when you present the mixed method approach, it could be a little bit longer in page length. And as we know, many journals prefer having you send papers that are 25 to 30 pages long, and sometimes that becomes a problem with mixed methods approaches. But ultimately, there are many benefits of this type of work. Mixing methods can enhance the validity or trustworthiness of inferences and assertions by providing mutual confirmation of findings. This occurred both in our Oxford House studies as well as in our ME and CFS studies. Mixed methods designs can provide deeper exploration of causal mechanisms, interpretation of variables, and contextual factors that may mediate or moderate the topic of study. And again, we saw this as a quantitative study found that friendship patterns were important, and that led to qualitative work with focus groups to try to understand what was it about friendship patterns in these recovery homes that made a difference. And those studies, ultimately in a sequential way, led us to working collaboratively with people from different disciplines on social networks research. So, and again, you can sort of see a program of research borrowing from quantitative to qualitative in our Oxford House studies. Mixed methods research can facilitate the development of culturally appropriate instruments and foster a deep understanding of the phenomena of interest. Clearly, our epidemiology study helped us understand the magnitude and the distribution of this illness on a community-based sample that was unbiased by help-seeking behavior, but to really understand some of the themes and the issues of the individuals who had this illness. The qualitative interviews gave us themes that resonated with us so that we could understand the experience of the illness, not just the magnitude of the disability that those individuals were experiencing. In conclusion, quantitative procedures have the most power to appeal to collaborators in funding and policy. So quantitative procedures seem to certainly be ones that different funding agencies seem to be a little bit more interested in, and often policy individuals like to have the hard numbers of saying, yes, this is the economic cost of this particular illness, or yes, for an Oxford House, these are the benefits over usual aftercare, that you can have a randomized study and you can basically find, for example, that these recovery homes actually do make a difference for those who get released from treatment for substance use disorders. On the other hand, qualitative studies are more likely to empower community members and gain insights into how to identify and work with participants. So, in a sense, the qualitative studies really are attempts to really get to appreciate the characteristics and the feelings of the people that are involved in these projects. And I can just say that by going to Oxford House meetings and going to Oxford House conventions, and by sitting down and talking with individuals and getting the individuals from the Oxford House movement to tell us what they think are important to study, and to involve them in thinking about how to study the topics, we actually end up with richer types of research that ultimately could lead to different types of funding sources, as was indicated in the Oxford House studies. As noted by myself and Dave Glenwick in a 2012 publication, another book on research methods, formative mixed method studies can be instrumental in learning how to access and develop trusting relationships with different sectors of a community. Combining these methods can be most effective when undertaking community-based issues. And again, a lot of the studies that I've been talking about during this presentation involve very close relationships with community members. This is participant community research. This is very much within the framework of community psychology. I am a clinical community psychologist, so that's the type of work that I do. These are some of the references that I referred to in the presentation, and of course, certainly they're available for follow-up. During a brief 35-minute presentation, I'm not able to go into lots of the details of these methods, but for those of you who have interest, I certainly would encourage you to look at some of the journals that are mentioned here, as well as a couple of the books that have come out that give much more details. I might add that the Handbook of Methodological Approaches to Community-Based Research has over 35 chapters in it, and the chapters are both on quantitative, qualitative methods, as well as mixed methods. And they're all give examples of how they were used by researchers, not only in the United States, but in other countries. Okay, at this point, you can submit your questions by WebEx or Twitter, and I will be available to answer your questions. And once again, I want to thank David for the invitation, and I want to thank you all for listening to me over the last few minutes.
Thank you, Dr. Jason, very much. Enjoyed your presentation. We have some questions, and others will come in as we participate in the discussion. So let's just start by asking some of the questions that we've received so far. You spoke a number of times during your presentation about challenges in getting projects approved or grants funded in NIH. Dr. Miles and I are sitting here at NIH today hosting this webinar, so we're always sensitive to those issues. Do you have advice for others in the audience who are thinking about putting a grant proposal together that would use both qualitative methods and quantitative methods? Are there lessons that you have learned in your years of approaches to avoid or to use that you think may increase the likelihood of success in the funding process? That's the general question. For example, have you found that reviewers expect that a good bit of the qualitative work should already have been done and be described in preliminary studies, and then the grant proposal may build on that, but the key feature of the grant proposal itself is a quantitative investigation? Or have you had success in getting support to do what is largely qualitative work in an NIH grant proposal that might ultimately lead to quantitative work, but the quantitative isn't actually included in that application? So let me pause and see what comments you have.
Thank you, David. That's an excellent question. And I do agree with you that I do think having some preliminary data, potentially qualitative or quantitative, certainly helps with all grant proposals. And to show that one has kind of some familiarity and comfort going from both qualitative and quantitative, I think can actually be a strength of a research proposal. One thing that you might want to consider as you're thinking about using a mixed method approach, and I do think that mixed method approaches can be funded, is that there might be an important issue of talking to the program official at NIH and basically finding out their comfort level with the mixed method. And if your project officer at NIH feels that it's something that they're interested in, then you might want to look at the review committee. The review committee, you actually have some influence in sort of getting your proposal sent to, because you can list which review committees you think would be appropriate for your grant proposal to go to. So you might go and actually look at the review committee members, which is listed on the web, and you can see, do the people who are reviewing the grants do mixed methods work? So, for example, if you have a grant that's sent to a particular review committee and all the people in the review committee do just quantitative or do just qualitative research, well, that will probably tell you something about the particular review committee. You might want to have a conversation with the SRO about whether it's possible for having someone that's maybe more of a mixed method researcher that's involved in it. But certainly, I would start with going to the project officer, because ultimately they're the ones who would be funding you, and asking them about what's the possibility of having a mixed method approach. Now, sometimes there is an RFA that might be focusing on saying, yeah, we'd like to have both approaches. I tend to think that if you have the equivalent design, in other words, they're both equally important, you might have more difficulties in the space to actually present all the information you need to justify them both. So that if you basically put a proposal that's dominant with one approach, whether it's qualitative or quantitative, and you have more time to really flush into the details, and then, for example, having a piece of it that's maybe, for example, qualitative, then I think they can get the flavor of one approach in a little bit more detail. Remember, you only have 12 pages to really make your argument, and that's not a lot of space. So I do think that probably focusing on one approach, really going into detail, going through all the methods, and then maybe having a piece on at the end that's secondary, that's a different approach, is actually something that I have done in several grant proposals successfully. And I think the reviewers have actually appreciated the fact that I had some flexibility, that I could, for example, say one study was a quantitative study where we really were trying to, in a sense, understand the epidemiology, the distribution of cases of ME and CFS in an urban area, Chicago. But we were also interested in finding out people's experiences that had this illness that could generate other potential hypotheses in the future, so that we could do some qualitative work with some of the individuals that we identified as having this illness. I think that that was something that was beneficial to the reviewers who thought that that was innovative. So when you're writing a proposal for NIH, you always have to think about what is innovative, what differentiates you from other people, because that's an important piece. The significance of the project's important, certainly, but the innovative section of it is very important. And if you can show that you're using mixed methods in very creative ways, that could get people excited and give you a fundable score.
Thank you. A follow-up question that's very much related. So in many areas, it's difficult for the PI, the principal investigator, to be an expert in all of the issues involved in a grant application. And as an epidemiologist, I'm used to working with teams where we have people that have skills in different areas that are helping to put the proposal together. That seems even more likely to be important in a project that's using mixed methods, where one person may be an expert on quantitative methods but not qualitative, or vice versa. Have you found that you need to have a team approach where you can have individuals with expertise in these various areas? But you've been doing this yourself a long time, but thinking about all the other people out there that are thinking about doing it, who may have strength in one area, is it better for them to try to become an expert in everything, or is it better for them to partner with people who are already experts in the areas that they don't cover?
Again, thank you, David. Another excellent question. Yes, I do think that it is important to partner with different people with different expertise. So if you have strengths in quantitative methods, you might have some familiarity with qualitative methods, but that might not be your strength. So to the extent that you can bring onto your team someone who has familiarity with that area, that really improves your team. And I might add that, you know, when we do research at the Center for Community Research at DePaul University, we're constantly looking for the best of people who have topic areas. So, for example, we reach out to an economist to help us work on economic issues. We work out with a sociologist who basically understands networks. We work with a simulator who helps us understand simulations as we develop models. So, and we also then reach out for people who have some of the more qualitative experiences of understanding and of the individual's experiences. So yes, in our Oxford House research right now, we do have multiple disciplines, and actually reaching out to people is easier than you think, because if you have a topic that's grabbing and they say this is something that hasn't been done, that is really interesting, come together and let's join ourselves with a team. They actually don't often, you know, you don't have to have money to even fund this, to get a team going. If you have money, that's great. If you have something that you can entice them to work with you, but they might just be interested in the topic or in the collaboration of the multidisciplinary group that actually will get them excited. Now, there are some risks involved in doing this type of work too. So, for example, I've seen collaborations where basically they've brought on 2 or 3 different people in an area. So let's say qualitative. And there are many different qualitative methods. And I've seen, for example, where you had 3 people who basically believed in 3 different types of qualitative methods. And ultimately, there was some difficulties in trying to figure out how to analyze the data, because each of them had their preference on a particular way. So I think early on, trying to set the boundaries, trying to find out the comfort level with the collaborators, trying to basically see how you're thinking about approaching this, from which particular methods. Just like with the publication, when you're going to write something up, you should really have discussions about authorship very early on. And I think the same applies here, that when you bring a multidisciplinary group together, there should be early discussions about what the roles are and how different strategies and tactics and techniques and methods will be used. And then when the data actually comes in, or the grant is written and the funding occurs, you really can try to minimize some of the potential negative sides of miscommunications and conflict that can occur if you haven't had those discussions really early on.
Thank you. You made a very good suggestion earlier about contacting a project officer at NIH early on as you're considering a grant application idea. We've always endorsed that kind of advice. Very important to speak to someone at the agency that might fund the project early on, describe the project, describe the rationale, describe the methods, to get feedback. Project officers can be very helpful. They can also offer advice on what would be a good study section to review the application. And you mentioned that you try to look at the membership of potential study sections and make your own judgment about whether it would be a good group to review your project. I want to ask a question related to that aspect. Sometimes the program officer is going to steer you in one direction. You look at the panel and say, well, they're all in this direction or they're all in that direction. They're missing certain kinds of expertise that would be important for my project. You've indicated that sometimes you contact an SRO to suggest that. Depending on the timing, it could be too late for those suggestions to be useful. If you've already submitted your application, for example, the SROs may have already pretty well booked the panel and it's too late to act on anything. Have you tried suggesting reviewers that might complement the existing membership when you submit your application? Is that a strategy that you've taken?
Oh, okay, this is a very complicated question because basically a scientific review officer who oversees the review process, you cannot basically ask them to put a particular member on that review committee. If you mention a person's name, whether it's a qualitative or quantitative researcher, they will not then use that person. So you can't basically indicate a name. Now you can say to a scientific review officer who oversees the review process, you have a great review team, you've got the topic covered, substance use or chronic illness, but I'm doing some stuff that's mixed methods. And is it possible to find someone, maybe as an ad hoc reviewer, to sort of complement your already rich group of reviewers? That's something that's appropriate to do. You can also talk to your project officer even before then and basically say, well, listen, I have a proposal that I have that basically will be using both approaches. What do you think of it? What types of review groups do you think might be interested in it? Remember, those project officers often sit in on review committee meetings. So as they sit in those meetings, they basically get a chance of sort of what types of reviewers are there. So they can give you great information. So yes, there are ways of influencing the process. If it's a special emphasis panel, usually you're not going to know who's going to be on it until right before the panel, maybe 30 days before. But if it's a regular review committee, all the members are listed, and they all have like 4-year terms. So you can actually see who's on the review committee, and you can research that, and you can actually do, and we do that. We do literature searches of the review committee members, and we find out what types of work, not just the topic, but also their style and how they feel about particular research methods. And if you don't feel that there's any competence on that review committee to basically understand your proposal, then you probably don't want to kind of target that review committee to submit it to.
Thank you. We have a few questions we want to get to. So one person asks, did you publish your studies as a single mixed method study or separate qualitative and quantitative research studies?
So, yeah, so that's a really good question. And this, again, comes up to one of the barriers that occurs with page limitations. We have one study that one of my colleagues is doing in Norway, and it's a qualitative study of people who got Giardia in Bergen and what happened to them a few years later. And in that study, because it was qualitative, we couldn't even put it in one study. There's actually 3 studies that are coming out taking 3 different aspects of it. And we have another study going on now about recovery, and we've interviewed physicians about how they define recovery for ME/CFS. We've interviewed patients, and qualitative studies, to really capture what's going on, we actually have had to divide them up into several papers. In our epidemiology study, our longitudinal study that I mentioned, we published some of our results in quantitative journals and some of our results in qualitative journals. And the reason that we did this was because to get through, to get that 25 to 30 pages was just very difficult to basically do them both together. So I would say we often split them apart, but not always. Sometimes we have basically had a journal that would give us the space, and we were just very careful about how much time we put describing the methodology of the quantitative and the qualitative so that we could get the richness of both the data, quantitative and qualitative. So I would say that often we do split them apart because of space issues with journals. If you have a monograph or a book, certainly you've got more ability to put them together. But there are some journals that are very interested in multi-method research. And you can submit your articles to those journals. And you just have to be a little bit careful with how much space you have to describe the different methods and as well as the results.
Okay. The next person writes, I teach occupational therapy master's level students and mentor research. How do you recommend better preparing them to embrace a mixed methods approach?
Well, you know, I do think if it's possible, if you have a course in quantitative methods, which is usually occurs in most of these schools, but maybe having a course in quantitative and qualitative methods. So if you could have courses in both areas, or at least one course in both areas, that's really important. And then, even better, if you could actually have a course in mixed methods as maybe an advanced seminar, where you have a chance to actually review studies that have used both. So I know I recognize that you know, lots of colleges and universities and graduate programs don't have the time and space to have all these types of methodology courses, but I would at minimum recognize for competence in quantitative, competence in qualitative, so at least one gets some experience in graduate programs in both areas. And then if you have the luxury of being able to have a course in mixed methods, that's wonderful. And you can also tell your students that they can potentially, for example, attend workshops, this type of webinar, or even kind of readings. And again, there's a number of books out there besides my own and Dave Glenwick's that, you know, cover these areas. So individuals who have particular interests, and I must admit, lots of students are really interested in getting competence in both areas. So I find that the students at DePaul, in our clinical community, in our community program, once they do quantitative methods, they want to then experience qualitative methods. And sometimes they want to actually do both, which is really exciting. So I find having some exposure to both areas is really very important. Even though one might be dominantly in one area, one can certainly have a secondary area that one has experience with. Enough experience so that when one wants to do collaborative research, one can then bring in an expert in that area that maybe a person is not that strong at.
Can you quickly provide the reference for Tashikori et al. 2003?
I can, and maybe I can do that by email to you.
Okay. I'll make sure it's posted on our website.
I'll get that to you. Yep.
Okay. And the next question is, I wonder if Dr. Jason might comment on multi-methods and the use or a multi-method versus mixed method approach. For example, using different methodologies from the same research paradigm, like a qualitative content analysis plus a phenomenological study.
Yeah, I think that's really interesting. That within a particular method, often using several different strategies can be extremely helpful to understanding the phenomena. And whether it's qualitative or quantitative, there's so many different rich ways of understanding stuff. In a sense, these are all just like toolkits. These are tools that we use to understand the reality of nature. And nature is complicated. Nature is not often linear. It's often kind of has feedback loops. It's often like systems that have to be understood. And really to understand those systems and the dynamics in those systems, we need to have the richest ways of understanding that. And I basically think that having the mixed method approach gives you the richness of that dynamic system that we're ultimately trying to understand, gets us beyond simple A to B linear logic, which unfortunately still represents lots of the type of work that occurs in our field.
Okay. Another person writes, one of the reasons I can think about why the qualitative research is relatively difficult to get funded is because the results of qualitative research might be difficult to be replicated and verified. So how do you deal with this concern?
Yeah, I mean, certainly, you know, that is people who don't have training in some of the qualitative methods are kind of are concerned about generalizable information. But certainly, if you understand that different contexts might draw for different types of phenomena and behaviors and attitudes, beliefs, that we can basically have a richness of a contextual way of understanding people in relationship to their environments, and how that basically, that transaction really occurs. And I think these types of methods that help us understand these phenomena are really incredibly important. And if some people dismiss one method or another method, you know, I think that's just a limitation of their own training, because the reality, each has riches to give us. And I think that, you know, while some quantitative research might be more generalizable, qualitative research has its strengths too, of understanding the depth of the knowledge of what's going on within that particular setting. So together, they really provide a story that often isn't told by one or the other.
Do you ever mix funding streams so that you get the quantitative aspects funded by one source and the qualitative aspects funded by a different source?
So that's an interesting question. I think that, you know, we primarily have focused on one source of funding to do our research, and it would be like a particular grant. And we often don't have like multiple grants supporting a particular area of research, but I think that is possible. There are some, for example, foundations that would be particularly more interested in one particular method than the other. Our group at DePaul generally doesn't go after foundation research. We just happen to go after more federal sources of support. But I think those units that are working with, for example, counties, working with states, working with not-for-profit organizations, working with foundations, there's probably multiple ways, local sources of funding that might be particularly more interested maybe in qualitative methods and outcomes than even quantitative. So yes, I think one can easily have multiple sources of funding, the different types of the research to be funded. Our group generally has not gone that direction, but I think some groups do.
Okay. Well, thank you so much for all of your useful information. And thank you, everyone who participated in today's webinar. On the Medicine Mind the Gap website, which is, again, prevention.nih.gov/mindthegap, you will find several resources for this talk, including the slides, references, and a link to complete an evaluation. Your feedback is very important to us as we plan future sessions. Thank you again for your time. Please join us next month for a session with Dr. Maria Fernandez from the University of Texas School of Public Health about the challenges and opportunities associated with dissemination and implementation research. Thanks again.